Right, and welcome back to Capital. Today, I am here in the other studio. My name is Raj Arya, and of course today we're going to talk about something very, very important that may have gone under the radar for quite a fair bit of time. And to talk about this topic on the immune system, or should I say the primary immunodeficiency, we have Dr. Amir Hamzah Abdul Latif, the consultant pediatrician and immunologist from Pantai Hospital, who is also the president of Malaysia Society of Allergy and Immunology, also known as MSAI. And together with him, we have Bruce Lim, the pro-tem chairman of Malaysia Patient Organization for Primary Immunodeficiencies, also known as MyPOPI. Wow, those are quite a mouthful indeed, but thank you, gentlemen, for being on our show this very morning. Now, before we start talking about this very, very important topic right now, Dr. Amir, can you just share with us a bit about your background when you came to medicine, and why did you choose this particular field to specialize in?
Thank you for having me here. It's, that's rather unexpected to ask me about my background, but no worries. I basically did medicine because of my past illness.
Okay.
So that's the first thing. Is I don't mind sharing it, and because of my kidney problems, okay, nephrotic syndrome, and then on did my postgraduate in pediatrics, and as part of that, I had interest obviously to do pediatric nephrology, but because of the disease itself, there was a lot of immunology in it.
Right.
So that's when I got hooked up and did my master's on that, the thesis, and then it just went on, and I did clinical immunology subsequently in the United Kingdom.
Right.
I basically have two specialties here, pediatrics and clinical immunology.
Right, I understand. So this is something related to your personal experience, and I guess it's about making a positive difference and hopefully helping others like you once upon a time, right?
Yeah.
Right. Bruce, now over to you. I understand you're the pro-team chairman of MyPOPI. Can you just share with us a bit about your personal story as to how you ended up as the chairman?
Okay, it is actually related to my son.
Mm-hmm.
I'm a parent with a son diagnosed with PID. Caleb is now 10 years old. When he was 5, he was diagnosed with PID.
Mm-hmm.
When he was 3, he was constantly ill and having various of infection. Most common infection is the lung infection. He was treated on the infection, but the illness kept repeating.
Right.
When there was once he has a very bad lung infection, and he was admitted to hospital for 20 over days. And in the event, his situation got worsened. He was put into ICU, and the doctors did whatever they can to prevent further damage to the lung. And again, I stress, the doctor only treat the infection, but not the underlying cause. Our ordeal ended when we have our family vacation in Australia, where his pneumonia reoccurred. Okay, we have to admit him to Royal Children's Hospital in Melbourne. Yeah, at that time, the doctors suspected that our son is immunodeficient.
Right.
Okay, we did. How they suspected it was because we relate the chronology of his infection.
Right.
And then they did a simple blood test, and it was confirmed that he has immunodeficiency. Then we came back, we did a blood test again in University Hospital, and also subsequently in Singapore, to confirm that he has X-linked Bruton agammaglobulinemia, which is short for XLA.
Right.
Yeah.
Right. So
that is where it prompts us the awareness where the doctors is lacking in Malaysia. That's why it relates us back to creating MyPOPI to bring awareness between the patient, parents, medical practitioners.
That's right.
Yeah, and general public.
Right. Dr. Amir, it's a bit scary that we're in the 21st century right now, and something like this is still happening when, as you mentioned, a simple blood test, which you did in Melbourne, actually identified this new, a PID, as you mentioned earlier.
Yes. You're very, very right in saying that this is very scary, and I think this is where we have to create the awareness. Now, the situation has been that PID has been here and has been picked up back in the 70s. And we say that it's been reported sporadically here, and unfortunately the awareness still keeps lacking. Up to the point when I came back from United Kingdom 2006, and that's when I also joined the Malaysian Society of Allergy Immunology immediately, and I decided that PID, which is my primary passion obviously, needs to be brought up, the awareness, the next level, all the way to the government, to the policy makers, to the Ministry of Health. And the concept that the Malaysian Society of Allergy Immunology had previously, when it was formed in 1998, was to adopt an orphan, and that orphan was actually allergic diseases.
Oh, okay.
Okay, and it's still a very problematic issue, because many even doctors think that allergic diseases are too trivial.
Yeah.
But I go on to say that MSAI then adopts the second son or daughter, a condition, PID, Primary Immunodeficiencies, since 2007, and we're trying to advocate that. That's what MSAI is here now, trying to get up and bring up educational programs and to increase awareness and be the body to advocate and to fight for the patients' rights, in a way, for equal health care for whatever diseases they have. And if you think that PID is rare, I would probably say no. Now, by definition, a rare disease is one that occurs in every 2,000 population. That's the definition. It used to be, say, back in the 80s, 1 in 10,000. And then became 1 in 5,000 because of the awareness. And in the 1990s, it sort of boomed because of the advance in technology of molecular genetic studies, and that's where Caleb had the blood test, the molecular genetic analysis. So since then, the whole human genome have been mapped out. We start trying to look what are all those genes representing, what are the proteins that it produces. And in the case of Caleb, if I don't mind, I'll just mention it. It's basically X-linked A gamma globulinemia, or XLA, Pluton's disease, named after the pediatrician who discovered that disease or described it back in 1952. And in this sort of situation, the immune system cannot produce antibodies. There is a lack. There is a gene defect that makes Bruton tyrosine kinase, an enzyme, a type of protein, that is involved in the development of the antibodies. So when this is lacking, when the gene is not there, the protein is not there, the antibodies cannot be produced. So when that's not produced, you can imagine the immune system as a defense system needs to fight off many, many infections, and that will be bacterial infections basically. And if they don't have it, you can imagine what has happened. The recurrent infections, some of them being severe, like the recurrent pneumonias. There are many warning signs in what has happened in Caleb that unfortunately was not picked up, and I think it was a good 3 to 4 or 5 years before finally somebody, the penny dropped, and sad to say, was outside of Malaysia that the penny dropped. But thank goodness that it did, and immediately the ball started rolling. Now, the test that was done is actually available here for quite some time, that simple blood test, which is basically to measure the immunoglobulins themselves, the IgG, IgA, IgM.
A very specific test, but
a simple test, just a simple blood test. You don't have to go on to do the molecular genetics, even if you didn't have it at that time. Because by having that and testing the B lymphocytes, which is part of the immune system as well, it's a very complex system, by the way, the immune system. So not being able to produce the antibodies means that he will have recurrent infection, severe, persistent, requiring intravenous antibiotics, and hence he needs replacement therapy in the form of intravenous immunoglobulin replacement therapy. So that's part of the, in a sort of a nutshell, what's going on and why we need to increase the awareness. Because I would just like to add, here quickly, we are probably only diagnosing about 1% of potential PID sufferers here currently in Malaysia. And coming back to your question, we are in the 21st century, so it's quite simple. More needs to be done.
Right.
And to be fair, yes, we have MSAI has been advocating this, and together with a group of doctors, which includes those who are passionate from the Ministry of Health. Okay, but I think things are just so dead slow that we need to now create this awareness in a different strategy. Okay, and hence why we feel that PID needs to be adopted by MSAI. We would advocate and bring up the expertise, the right training to treat PID, allergic diseases, or any other immune-mediated diseases as well.
Right. Okay, Dr. Amir, I'll be coming back to you very, very soon on what you have just mentioned. Bruce, just want to ask you, your experience, of course, it has been quite a traumatic time for you, trying to figure out, because it's always keep persisting over the years as well. So in terms of that time before he was diagnosed correctly in Melbourne, how did you cope with the entire situation? Does this mean he has repeated visits to the hospital, to the doctors?
Yes. When he was a toddler, he has been often ill with frequent hospitals visits, frequent stay in hospital is like regular. So yes, with all the infections that a child can have, even an ear infection, lung infection, bronchitis, you name it, he has gone through it.
Right.
Yeah.
Right. And this has been going on over the years.
Yes, over the years before he was picked up in Melbourne.
That's right.
And then when he was year 5, he was diagnosed with PID.
Right.
And that's where we were referred to Dr. Amir. And from there onwards, he is having his treatment with IVIG, as what Dr. Amir has mentioned, three weekly, and he is now perfectly fine, just like a normal kid.
But the difference is you have to be constantly on this treatment indefinitely, or is it for just a specific period of time?
Unfortunately, it will be lifelong.
Lifelong,
yeah.
Right. Now, Dr. Amir, just now you talk about PID. Now, we know this is something very serious, going under the radar, undetected. Probably many people are going through it in their lives without even realizing they've been having this all along. Can you just share with us, how do you define PID? I believe there's more than 200 types or forms, in fact.
Yes, there are more than 200 types of PID, and since the majority are what we call the antibody deficiencies, predominantly antibody deficiencies, about 60%, and that's the sort of numbers that we've accumulated and found here as well in Malaysia. And each of the disease will have their criteria. So if you look at the more simple ones, like the antibody deficiency, I'm going to talk about just that and another one that we call severe combined immunodeficiency, right, or SCID, S-C-I-D.
Right.
And with that, we will just do the simple blood test again.
Right.
All right. We look at the immunoglobulins. We look at the simple full blood count to look at whether the lymphocytes are present, and more specifically, a second level. So we can say that in the investigations or the tests, we can do the first simple test of screening of full blood count and immunoglobulins, and then thereon we take it at a more specific test.
Right.
So for each one of them, diagnosing means it's still going to be a clinical suspicion. If you want to diagnose PID, you have to think PID.
It has to be on your mind, right?
All the time.
Otherwise it just go over you.
Exactly. So that's the simple concept. So to all and everyone, the public, the doctors, the government, think PID. Then you will start to test for PID. Then you will diagnose PID, and then you will treat it accordingly. Because if you don't treat severe combined immunodeficiency or SCID, that leads to mortality.
Yeah.
That leads to a situation where death is imminent unless you do a stem cell transplant, a hemopoietic stem cell transplantation.
Right.
And it's not that it cannot be done here. And SCID, I would like to emphasize, is what we call a pediatric emergency. The minute you diagnose it, you must treat it and do the bone marrow transplant.
Okay.
Okay, and I would say that many patients probably have gone under the radar, and those that have picked up, unfortunately, by the time they come to us, they're very, very ill and basically becomes fatal.
Right.
So we need to beef up on the awareness. I would say, and I can safely say, that the awareness has increased amongst those who are aware, but it is there in the public, the community, that maybe it's not being picked up as fast as I would have loved it to be.
Right.
And I think this is where the government starts to help, right, to increase the awareness, to support MSAI and MyPOPI, which will come to in a while, and to create the right training. Now, we, amongst us who are really into PID, not many of us,
Yes.
Unfortunately, but fortunately, I think we tirelessly work together, both from the academics, in the private practice, and in the government as well, to form what we call the Malaysian Primary Immunodeficiency Network.
Right.
And from here, we had a lot of educational programs, including what we call the National Clinical Immunology Symposium, NACLIS as we like to call it.
Okay.
And the last one we had was back in the 6th, or rather the 7th, recently concluded, but the one last year was very important, in October 26th and 27th of October 2013. We had eminent global experts coming at a forum to talk about how to bring this forward and create a template, a strategy to treat an PID.
Right. Dr. Amir, I have to interrupt there for a moment.
Yeah.
I have to hold that thought because we have to take a commercial break right now. But later in our second part of this interview, we're going to go into greater detail in terms of what you have mentioned, what we have learned from that forum, what are the activities taken place recently to create this awareness, and of course, how did MyPOPI come about, and what are the activities they have also engaged in playing their part in order to get the message out there to the masses of the importance of PID. So please stay tuned on Capital Today, and we'll be back very, very shortly. Right, and we're back here in our second part interview on PID, where I'm speaking to Dr. Amir and Bruce. Now, earlier you were talking about the conference/forum, whereby it's there to, in fact, take the awareness onto greater heights. Can you just elaborate a bit more?
Yes, that was part of the National Clinical Immunology Symposium, which the Malaysian Primary Immunodeficiency Network has organized since 2006, 2007. And 2009 was the first NACLIS, and at that time we had the Director General of Ministry of Health. And at this particular one in October last year, we had the Health Minister officiating, Dr. Subramaniam officiating the conference, which we believe is a very important conference and forum, whereby we had global experts, very eminent experts from Oxford, from Hong Kong, from Japan, and we also had, as part of it, the International Patient Organization for Primary Immunodeficiencies, or MyPOPI, jointly organizing the first patient PID workshop together with MSAI. And what I'd like to also highlight is the fact that the Health Minister did acknowledge, and these are cuttings in the New Straits Times, by the way, so it's all archived on the internet.
Right.
So as what he's mentioned, that obviously there's a lack of awareness, and it needs to be brought up. And the government did quote that will take measures to increase the expertise in the field, to have more tests and diagnostics and research, and so that there will be better treatment. So there'll be better quality of life. So I suppose MSAI, MyPOPI, we are going to hold on to those words very strongly, and so that patients do not suffer any longer. And so with that workshop, the MyPOPI was really very good, and the awareness and the need to have our own local, national patient organisation. Primary Immunodeficiency was then mooted, and then I think eventually the MyPOPI was born. I think I'll let Bruce talk about it more, you see, because I think he's in the thick of things. We are there to help MSAI. We have the medical advisory board, obviously, for MyPOPI, but they will be the main movers. We will guide them, and obviously we'll have the necessary talks with the government eventually as well. And I think that's not too far off now.
So Bruce, I assume that the seed was planted at that particular workshop, which I'm sure you attended.
Yes, correct.
Right.
Yeah, the workshop was attended by a group of parents, patients. That is where we relate our experiences, and also we listen to the expertise on the global scale. There is where we found that there's a need to create this awareness and to bring this awareness across to the parents, patient, to the medical practitioners, and also to the general public in Malaysia. So that's where we started to the born of MyPOPI.
Right.
MyPOPI stands for Malaysia Patient Organization for Primary Immunodeficiencies.
That's right.
Okay. MyPOPI is a non-profitable organization. We are in the midst of registering MyPOPI with the Registrar of Society, ROS. Basically, MyPOPI is a member of IPOPI,
right.
International Patient Organization for Primary Immunodeficiencies.
That's right.
So the objective of MyPOPI, number one, basically is to bring awareness of PID in Malaysia. Okay. Number two is to be a communication bridge between patient, parents, medical practitioners, policymakers, and also general public. Yeah.
Right.
Number three is, of course, to create a support group whereby the patient parents can meet together and relate their experiences.
Right.
Okay. The main aim of MyPOPI at this moment is really to push forward to Kementerian Kesihatan Malaysia, KKM, to recognize clinical immunology as a subspecialty, whereby they will create more doctors in this field to treat both pediatric and adult patients.
Right.
Yeah.
So currently, how many patient-parent members are there?
Right now we have about 8 person. We started this MyPOPI.
Right.
Yeah.
And then slowly expanding once you get more awareness. I think a lot of people would fall into this boat, but they're unaware of its existence at the moment.
Correct. So we are right now registering, and then we will have a general meeting, whereby many of patients which is not aware of MyPOPI, we will room them in to bring to get them more involved in MyPOPI. Yeah.
Right. When we talk about all these ailments, illness, disorders which we see in general out there, of course, the big ones are the ones which are affecting the world on a global scale, as in the past, it's really like SARS, bird flu, and of course the most recent, the Middle East respiratory syndrome, MERS coronavirus. So of course that is one aspect because of all the publicity behind it. That's the reason why the focus is there. Whereas as we discovered, because this is a bit under the radar, less emphasis is focused on this, and this of course needs to be addressed very, very quickly, right?
Yes, very, very much so. And I think whatever highlight that MERS-CoV gets, PID gets. To put it very simple.
Right.
Because as I already mentioned from before, like skin, it's a severe combined immunodeficiency. And it's, we talk about fatality there, obviously 100% if there's no transplant.
Right.
And if you do the transplant, more than 95% are curative. So I think people probably need to also understand, and people is everyone, is that when you talk about, let's say, you think, oh, it's a transplant, it's got to be expensive treatment. But when you look at the economics of it, after the transplant, they've already cured someone, he's healthy.
For the rest of his life.
For the rest of his life. But if he's not gotten that transplant, the baby dies. So how do you put value to life?
That's right.
Okay, so that's where once we put the numbers together, and taking the other example of like Caleb with the intravenous immunoglobulin replacement therapy, it's lifelong, it's true, and people are thinking, wow, that's going to cost as well. But numbers, we don't have the numbers here in Malaysia yet. But I'm going to quote from the Jeffrey Modell Foundation, which is a foundation created by parents as well, for their son who had PID and requiring immunoglobulin replacement therapy. So what they have come out is, on their website, they have some sort of like a registry whereby they can pick up numbers, not just the disease, the symptoms, but also the costs.
Right.
So what have they come out? This is published data. You can go to the Jeffrey Modell Foundation, for whoever is interested will look into that. And they will quote that for those who were not diagnosed initially with PID, it was about close to $140,000 per year.
Wow.
Okay, but once they have been diagnosed, it comes to about only $60,000 per year to treat. So the economic impact is that there's about $80,000 already saved, which then obviously can be channeled to other conditions.
Right.
So we are not trying to say that PID is more important than others, because in the last few days we've been hearing about diabetes suddenly over exceeding the and but on the other hand, we need it to be equally recognized, and the right treatment, the right test, the right treatment be given to patients with PID rightly. Because when you look at those numbers, certainly the savings are there already without any doubt.
That's right.
So that's why I think if we say that, okay, going back to the MERS-CoV and HIV, the AIDS, so we hope that there will be the same sort of publicity, simply because the mortality is just as great. Now, MERS-CoV, if I get it right, the mortality is about 30%, but if you take SCID, it's 100%. So how do you compare?
Yep.
All right? And so we have to look at this in the bigger picture.
That's right.
And I do hope, and I do expect, and that's one of those things that it's not just here in Malaysia, it's a global thing.
Exactly.
Up to 70% or even 90%, depending on which part of the world, of PID are still under-recognized. Up to 90%.
That's
So,
scary. Scary.
yes,
Scary
that's right.
statistics.
Yeah. And here in Malaysia, for those patients that have been referred to us, the small numbers, we have already been collected about or been referred about 200 patients, and we have confirmed about 150. But like I said much earlier on, that only represents the tip of the iceberg. Only about 1% that we think has been, that's still 99% that needs to be found and diagnosed, treated accordingly.
Right.
And that's when I'm glad that, Bruce, you brought it up about getting the subspecialty of clinical immunology. Thank you very much, because I think we have to also create the critical mass. But mind you, then people start thinking, oh, well, trying to train a subspecialist will cost money. But the WHO, the International Union of Immunological Society, IUIS, and now is the World Allergy Organization, at that time was the International Association of Allergy and Clinical Immunology, came out with a document back in 1993-94 that suggested that really the number of clinical immunologists that one really needs per million of the population is probably 1 or 2. So we don't need that many in the first place. So if we can get the numbers right, and we have 1 clinical immunologist per state, and that should be enough really to start catering. The rest of it obviously comes with the bone marrow transplant, and we have one there in the Pediatric Institute. And as we speak, I know there's 1 child with severe combined immunodeficiency on the waiting list for a bone marrow transplant.
Okay.
So that gives hope that now that we are going to be taken more seriously, the patients with SCID are going to be treated accordingly as what it should be, as a pediatric emergency. Okay, it's a life and death situation. You don't do the transplant, the baby, a 3-month-old or 8-month-old, but certainly majority won't reach their first birthday, going to die. So that's where I think we have to look at the whole bigger picture.
Right, right. Okay, we're almost running out of time already, but before we go, very, very quickly, Bruce, from your perspective, from a patient's, parent's perspective, what is the one thing you would like to see being done right now by the government, perhaps?
As I mentioned earlier, it is definitely to push across this message where the policymakers recognize clinical immunology
That's right.
as a subspecialty, especially Kementerian Kesihatan Malaysia,
Yep.
KKM, and this is to bring awareness to the
That's right.
to the masses, where PID is primary, is critical.
Right. More expertise and more resources going to this area. And Dr. Amir, what about the notion of perhaps creating a special center for this, like in some other countries, which will have to actually focus on this? Would that be viable?
It should be viable, and I think, like I said, the bone marrow transplant unit for pediatrics is already there. It's not that we cannot do it. We just need to do it.
Right.
So I think there should be emphasis on priority as well. If it's a pediatric emergency, we treat it. So and then we can obviously identify 1 or 2 other centers, and then we become a center of excellence.
Right. And I guess the question now is all about detection, getting out, because they say prevention is better than the cure, or in this case, catching it early so that it can be diagnosed early and treated early. And of course, when it boils down to, it will lead on to the economic sense of bringing down the costs incurred, especially as we know that in any country there is a limited budget. For Malaysia's case, it's about 22.1 billion ringgit, and we can already see it being stretched to the seams as we speak. So we all need to play our part in terms of addressing this current problem. Bruce, Dr. Amir, thank you very much for your time today. It has been most informative, and hopefully with this information, perhaps parents who are watching this right now, this may have struck a chord with you that your child could be suffering from PID and you have been unaware all this time. Well, you know what you need to do right now. Go into the hospital, take the specific blood test, and hopefully you and your child will be able to lead a very, very long and hopefully healthy life. With that, we're going to take another quick commercial break right now. I'll be back with more corporate news, business developments here on Capital Today.